Hi, my name is Jillian Shotwell. I'm the Quality Improvement and Outcomes Program Manager here at Healthwise. This video is meant to give you an overview of our Quality Improvement and Outcomes program and how we can really collaborate with you as a client to measure the impact that health education has on quality initiatives, research studies, etc., happening at your organization. The Quality Improvement and Outcomes team at Healthwise really focuses on supporting three main buckets of work. The first is pilot and demonstration projects. So think things like Center for Medicare and Medicaid Innovation Grants or other innovative pilots you're involved in. Supporting research projects or funded research grants that might be happening at your organization with education and project support, as well as quality improvement activities that are important to your organization. So think a specific maybe initiative around hip and knee replacement, or a specific education campaign or quality improvement campaign around HEDIS. What we do is really unique to the industry. So it's one thing to have patient education, but it's another to help to analyze the impact and then improve both our service and support quality improvement at your organization based on what we learn. Our team has a significant background in public health research and data analysis, and we can help you with anything from identifying metrics available to help you measure success, to analyzing data for you, to helping to communicate out your success to a broader audience. As a team, we can analyze and interpret data, both ours and yours, in-house, and we really work with our partners and our clients to build effective and high-impact quality improvement project plans, and then help to act on those plans. We work with clients to measure impact of education on areas that are most important to you. So as an example, let's say you're trying to meet an asthma medication ratio HEDIS metric. What we can do is help to develop suites of content that help to support meeting that metric. We can help to identify pieces of data that might be important to collect on your end. And we can really help to create, shape, and then support analysis of a quality improvement project and show how education has been just a piece of the efforts that your organization has taken to really move the needle on, say, that HEDIS metric or that quality initiative that we are focusing on. Ultimately, we connect innovative clients with one another to learn from and share best practices, as well as help to really broadcast your successes more widely. We have both hospital system as well as insurance clients across the US and Canada. So we have a pretty large network and can help to support and allow our clients to learn from one another. Our team has two really main areas: data visualization and data analytics, as well as those quality improvement in-depth projects. So all of our quality improvement projects are collaborative endeavors. We utilize both internal Healthwise data around patient education, data from your end about our project of interest. So the mutual goal is to identify the effect of patient education on improving those outcomes. But obviously, we can't run a quality improvement project if we don't have that data and those analytics. So the first step is usually to identify data on the Healthwise end available to your project, as well as support the identification of data available on your end to follow through with that QI project. If you already have a project in place and you'd like to incorporate education or get our guidance on how to improve the measurement of that project, we can be as involved as works best for your organization. So we can partner from the beginning, we can step in and out as available. You really let us know what works best for your project and your organization. I wanted to bring a few project examples here. Before I get started, these examples are by no means the only types of projects we could work on together. I just brought a few here, but if there are other HEDIS metrics, if there are research studies that you'd like us to partner on, we can really chat about any possibilities that are of interest to you. So please feel free to reach out to your account manager if you'd like to have a deeper discussion around any of these projects, or if you'd like to talk about another project that you have been thinking about or that's already in the works. The first example is statin adherence example. So we worked with a plan out in South Dakota to support the provision of education around statin medications and statin adherence for members with diabetes on their health plan program. So what we did was we measured what was the statin adherence rate and a few other metrics both before the implementation of this education campaign. And then in that group, what was the statin adherence and again, other metrics. How did those change during the implementation of this education campaign around statins for those folks with diabetes? What we saw was really impressive. We saw an increase in the level of statin adherence for the population that received education through their coaches of 9%. We saw an increase in LDL or cholesterol control of 12%. And what we also noticed was that the higher the open rates for education, so the more engaged these members were in reading about the statin content, the better we saw these outcomes. So the better the statin adherence and the better controlled that LDL was. Moving on to smoking cessation. So we partnered with a health plan to help to increase the dissemination of information around smoking cessation, as well as information around their smoking cessation program. So we are integrated with a digital health partner of Duke Universities, and that's how we were able to partner on this quality improvement project. So for individuals at Duke who had identified that they were a smoker on their patient chart, an email or a text message invitation about Duke's smoking cessation program, as well as to provide information around smoking cessation and the importance to a patient's after visit summary. They were then invited to Duke's virtual smoking cessation program. The outcomes from this study were a significant increase in the number of program information requests received on the program. So because our integration with the digital partner allowed for information to be sent in an individualized way, so email or text based on what the patient wanted the most, saw a significant increase in those information requests from that program info. And then ultimately, this virtual smoking cessation program saw a 30 to 35 times smoking cessation rate compared to an unassisted individual trying to quit smoking. So really impressive results from this program, and we were able to highlight it because Healthwise education was used to try to highlight the importance of smoking cessation in this population. And then finally, we also worked with a partner who aims to incentivize health education in order to measure the return on investment that health education might have for an organization. So as a part of this intervention, this one was a research study that we partnered on. The partner provided web-based Healthwise education, and this education was sent to patients from their provider. The provider received an incentive to send education, and the patient's copay was waived if they reviewed the education sent to them. Participants here were an employer health plan. And we saw really impressive return on investment results. So in an ideal world, right, we're incentivizing patients to open education. However, when we do that, this study found a 10.8% reduction in per capita cost for those patients who reviewed education. They saw a 14% decrease in ER visits in this population, and they also saw a 32% decrease in hospitalizations. So again, this was an incentivized program. So we recognize this is an ideal world, but it's really impressive to see the impact that education can have when it really does get to patients and helps them to learn about their conditions, their medications, etc. We have so much more information on all three of these project examples. So if you'd like to learn more about any of these three projects, or if you'd like to chat again about projects that you have on your mind, please feel free to reach out to your account manager, and I would love to discuss. So just to wrap up, We're really here to help support any quality improvement, research studies, or ongoing strategic initiatives that are happening at your organization. We're here to support and be as involved or as just supportive as is most helpful to you and your endeavors. We can help you to spearhead a quality improvement project or even an internal reporting project. And we can also help, again, to collaborate on analytics and data visualization to help you measure those metrics in a really organized and robust way in partnership with Healthwise data. If you'd like to discuss further, please just speak to your account manager, and I'd be happy to set up some additional conversations with you for project shaping, to learn more about what our team does, etc. Thank you very much.